in the Americas, including our facility in North Carolina, where we are now manufacturing an additional 40 to 50 million masks per month to get into the U.S. healthcare system. And we talked a little about this in the pre-meeting. One of the issues we're struggling with is the demand increase. Used an anecdotal example of one hospital in New York that traditionally uses roughly 10 to 20,000 masks a week are now using 200 to 300,000 masks a week. So you multiply that times the entire U.S., let alone the same demand outside of the U.S. That's part of the issue we're running into, is even with a significant ramp up in supply, there's still that demand that is much greater than that supply.
Thank you very much. And I bring that up because when we discussed back in a room, we were in a conference room, very nice one actually, it's called the Cabinet Room. That statement was made that they've been delivering for years 10 to 20,000 masks. Okay, it's a New York hospital, it's packed all the time. How do you go from 10 to 20 to 300,000, 10 to 20,000 masks to 300,000, even though this is different? Something's going on, and you ought to look into it as reporters. Where are the masks going? Are they going out the back door? How do you go from 10,000 to 300,000? And we have that in a lot of different places. So somebody should probably look into that, because I just don't see from a practical standpoint how that's possible to go from that to that. And we have that happening in numerous places. And not to that extent. That was the highest number I've heard. That's the highest number you've seen, I would imagine, right? But this man makes them and delivers them to a lot of hospitals. He knows the system better than anybody, and I think you were more surprised than I was when you saw that number, so thank you very much. I hope.
It's a national healthcare emergency, and this dude right here wants reporters to investigate theft or what's the word I'm looking for? Perhaps unethical behavior on behalf of the front line of defense to a pandemic across the globe, the medical community. Really? And you wonder? Like legit, he wonders why no one respects him.